Hello, my name is Maie St. John. I'm a head and neck cancer surgeon at the Johnson Comprehensive Cancer Center at UCLA. One of my mentors said to me, Maie, you might want to check into head and neck surgery. I was absolutely taken by the beauty of the anatomy. This is the anatomy that underlies how people smile, what defines who they are, their face, their personality. These are nerves that allow them to kiss their children goodnight, and I became very fascinated with trying to help patients who had cancer in this area. Where patients have a tumor, we obviously want to resect the tumor in its entirety, but we don't want to over-resect. We don't want to take nerves or a portion of somebody's face or tongue that we do not need to take if the cancer is not there. One morning, I was heading to the hospital to operate on a young woman who had two very small children. And heavy on my mind was the fact that I was going to be taking a portion of her tongue. The question really kind of weighed heavily upon me, Maie, how much of the tongue are you going to have to take? Which is a question that so many of my patients ask. And as I was backing out in my hurry to get to the hospital that morning, I started hearing my car say beep, 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 because I was getting close to the front hedges. And it dawned upon me in that moment, well, you know, my car has a sensor that allows me to know how far I am from different objects such as trees or other cars. How come we can't build a tool that would allow me to see cancer down to the cellular level in the operating room? So when the patient wakes up, I could tell them, I precisely resected your tumor and I saved everything down to the last cell that I could. So the system that we have built is called the DOSI system, or the Dynamic Optical Contrast Imaging System, and this is the system that we're currently using in the operating room now in an effort to try to resect tumors precisely. This system was built here at UCLA, and the beauty of the system is that it was conceived and built in collaboration with Dr. Warren Grunfest and Dr. Zachary Taylor. And that's the beauty of working at UCLA and the Johnson Comprehensive Cancer Center, is that interdisciplinary or transdisciplinary research is really supported and fostered. Here at UCLA, we have the privilege of having been surrounded by very brilliant scientists and physicians. We are very blessed to have many people support UCLA and to have the resources. And as part of continuing our growth and our understanding is really partnering with the world. So as we continue to form partnerships and understand head and neck diseases globally, we will enrich our understanding of disease, learn from our counterparts and colleagues all around the world, and also provide them with unique science and discoveries here at UCLA. So many of these opportunities are about relationships, and one of the things I'm very dedicated to is allowing our residents and trainees to really be a part of the global community, to understand that our patient care is not just here in Los Angeles, but it's throughout the world. With the advent of smartphones and telemedicine, the world has become a pretty small place. And we're able to, in addition to seeing patients here in the clinic, we're able to see patients as part of telemedicine, review their scans, see them in the clinic with their doctor as many as 10,000 miles away. And this really allows our residents the opportunity to understand how medicine, surgery, and science are practiced globally, and we can also bring our unique aspects from UCLA to communities all around the globe. It is my hope that our residents and trainees and our team here at UCLA will be able to go and train in all sorts of international clinics with our partners, and that their fellows and trainees will come here to UCLA, and therefore we can become part of one global family. We are very excited at the prospect of developing relationships internationally in the academic realm, whether it be surgical, research, science, education. This opportunity through UCLA is one that can't be missed.